Hello, everyone. I'm Assemblymember Rebecca Bauer-Kahan, and today I'm joined by Dr. Scieli, Deputy Health Officer from Contra Costa County Healthcare Services, who will be giving us an update on the newly announced health orders and explain what's changing and what's staying the same. The last update to the Bay Area health orders was May 18th, that allowed for curbside retail and associated manufacturing. Additionally, non-emergency medical procedures and routine dental care can now be conducted, so no excuse for not getting your teeth cleaned. Additionally, vehicle-based religious and ceremonial events like graduations can now take place in outdoor areas such as parking lots for 3 hours or less. And we've seen a lot of those happening with our high school graduations, and it's been so fun to watch those students walk across that stage, even if they don't have a crowd of people there. Updates to our health orders are based on a set of local indicators that were announced in April by the county. They establish measurable goals that inform us on how to safely move towards opening. The indicators are the total number of new cases identified as either flat or decreasing for 14 consecutive days. That no more than 50% of patients in non-surge hospital beds are COVID-19 positive, making sure we have the hospital capacity for the patients that need it. At least 200 COVID-19 viral detection cases are being conducted per 100,000 residents. So that's testing, so that we can test at least 200 people per 100,000 residents. That there is sufficient case investigation, contact tracing, or quarantine capacity. The counties are trying to build up capacity to track and isolate at least 90% of the cases. So for those people that test positive, we need to be able to track and trace 90% of them. That means building up our tracking and tracing capacity. The counties have to have at least a 30-day supply of personal protective equipment, and that needs to be in our hospitals. So knowing that they have the PPE to protect our frontline workers is really critical. So all of this is really focused on making sure we have the hospital capacity to serve all of our residents that need it if there were a surge, and also to make sure we know what's happening in the community with testing and tracking and tracing. And I want to commend the county for these very clear, measurable indicators that we can track, and it's on their website, so you can look it up and see for yourself how we're doing on those. And the Chronicle actually released a really good indicator page that can help you to see what we're doing. So now I'm going to turn it over to Dr. Scieli to talk a little bit about what's going on. As I mentioned the indicators, Dr. Scieli, and tried to explain them, but correct me if I did anything wrong. But can you talk a little bit about how those help inform your decisions to loosen restrictions or dial it back if necessary, and how we're doing on the indicators?
Yeah, so those indicators are the main data pieces that we look at to see if we're ready to open more. And every time we open more, we look at how those are doing to see if we're still doing okay, if there's a surge or not. And we continue to watch those on a daily basis, sometimes hourly basis. We're doing okay. You know, the case numbers, the hospitalizations, and the personal protective equipment, those three indicators are doing okay. The two that we're still working on are the testing, and we encourage everyone to get tested, symptomatic or asymptomatic. You can get testing information on our website at coronavirus.cchealth.org. And the case investigation and contact tracing. So those are the two that we're still building up. We're not exactly where we want to be, but we're getting there. Every week is a little better. And we're working a lot with our partners, our partner systems like Kaiser, John Muir, Sutter, CCRMC, the Community Consortium of Clinics, to get more testing done. And we're also hiring people, training them in contact tracing. We were the second county in the state to get on the new state database for cases called CalConnect. And so we're pretty pleased. And so far, we've been continuing to open as planned because the indicators have been okay.
Great, that's great to hear. And congratulations on getting into that tracing program. I know it was something we worked together on, and I think it's going to lead to really great data collection, which is important in knowing what's going on. So I commend you and your office and all of the Bay Area counties and the work that you have done to make sure we're aware of what's happening in our communities and keeping our hospitals where they need to be. So thank you. So yesterday you announced the new health orders, which go into effect today. Can you give us a summary of what that new health order includes?
Sure, I'll just go through a few areas. The first is indoor retail is now open. And for all of these, there's state guidance on, social distancing, masking, making a plan, posting a plan for the employees, that sort of stuff. Those can all be found on the state website at covid19.ca.gov. And for every segment of retail, there's separate guidance. Shopping malls can open as long as they make a plan and submit it to us for approval. That includes shopping centers and swap meets as well. The places of worship can open for outdoor services up to 100 people beginning June 15th. And on that same day, beginning June 15th, they can open for indoor services for up to 12 people or 25% of the building capacity, whichever is less. So that's coming right up in less than 2 weeks. Let's see, office workplaces are open and able to operate. We still encourage telecommuting, but otherwise offices can open as well. Outdoor museums and exhibit spaces are able to open. Libraries, for the most part, are able to open as well. Drive-in theaters as well. There's a new stipulation on small social gatherings, group of up to 12 people. We call them social bubbles. And, you know, the important thing with those, and those can meet outside with masks on, but if you and another family want to get together for a dinner, let's say, that's allowed now, or like a Cub Scout den, something like that can happen now. The main thing with that is not to belong to a bunch of those. You pick one and stick with it. It becomes sort of your germ pod or bubble, if you want to call it that. And you stick with it and you continue to practice social distancing and masking. So that will also be a nice addition to what can happen now. Protests are up to 100 people can also happen now. And that's obviously relevant given what's going on in our communities these days and the social justice work that's going on. You know, there were some businesses that generally do not require close contact, like car washes, dog walkers, businesses that provide services inside, like electricians, janitorial, heating, air conditioning, plumbing. Those were available earlier for people, for, you know, only necessary stuff that was necessary to maintain the habitability and safety of the home, or only for like pet grooming was the health of the pets. But now that's open in general. And the other thing that's slightly expanded is childcare, including summer camps, was before open to just children of essential workers, and that's just also now open in general. So, a lot more stuff is opening, and we are looking at you know, this in 2-week increments in general. So we're expecting to have another announcement about 2 weeks from now. The one issue that may come up sooner than that are swimming pools and outdoor dining. We're looking at that in the next few days, so should expect to hear something on that sooner than that.
So that's exciting. What would the parameters around swimming pools and outdoor dining be? Do you know yet?
I don't know, but I think if the numbers hold up, we're looking. It looks like we may allow outdoor dining for restaurants as long as they can put the sufficient distance between the tables, etc. For swimming pools, I think it's a little more subtle. I think the main thing that we're worried about is congregating of children and bunching of a bunch of people in very close quarters, you know, so on the edge of the swimming pool. It's not so much the swimming itself that we're worried about. So we'll be looking at that and coordinating with the other Bay Area counties to sort of put out similar guidance with all of that.
Great. Yeah, I know we're getting a lot of calls on some of those things that we now know the counties are diverging a little more than they have in the past. And so, of course, like you, we hear when, oh, San Mateo has pools open and this county has outdoor dining. So that's good.
I think we'll get there very, very soon.
Great. Yeah. Can you talk about, so as you may know, I represent both Contra, Costa, and Alameda County. And like I said, it seems like the counties are starting to diverge a little bit more than they have in the past. Can you talk about if there are any major differences with Alameda County or neighboring counties?
I don't think there's major differences. San Mateo sort of split off the big group of 6 a few weeks ago, and they're sort of going basically with the state guidelines right now. The other counties and the city of Berkeley are still sticking mostly together. There's subtle differences. Everyone's 2-week periods start on a different day. So for example, I think Alameda County will start their 2-week period on Friday. So I'm not sure about that, actually. I don't want to speak for them, but I think that, I know Santa Clara started a day before we did, and San Francisco has outlined a slightly different schedule, more or less in line with us, but I think they have some more openings on June 15th and then a bunch more on July 15th. So each county is just a little bit different, but we are talking every day. Our data people are coordinating every day to see if we see a surge in one part of the Bay Area or not. We're looking at where testing is happening. We're looking at hospital capacity as a regional resource. So we're still coordinating on all of those and on our messaging as well. So a few subtle differences. You might see pools or outdoor dining opening in one place, just a little sooner than other places, or slight subtleties in terms of how many people are allowed inside the churches and so forth. But the general principles we're together on.
Great. I mean, I have to, again, and I've done it before, but I'm going to do it again, commend the Bay Area for working so well together. As many of us know, we often work in one county and live in another. It's just the way the Bay Area functions. And so it's so important that you guys have worked so beautifully together. And thank you for that. I think it's really helped keep us safer. My last question for you, Dr. Scieli, is if people want to read more, you went over it, but maybe quickly, where can they get the most up-to-date information on the orders and what is and is not allowed? Where should they look?
They should look at coronavirus.cchealth.org. You'll always find the latest orders, the latest frequently asked questions. You can find the 800 number there in case you want to call and get tested, and when we really want people to call and get tested. That's going to be key. As we open things up more, we want a lot of testing so we can identify clusters early. It's like putting out the spot fires before it turns into a big fire. So cchealth.org, coronavirus.cchealth.org. That's where you want to go.
Great. Well, thank you. And I know, like I said, with the new technology you have and the great tracing work you guys are doing, hopefully we'll have great data coming out of that testing, and we will know before anything escalates what is happening in our community. But I just appreciate you working. So you and your office and the county is working so hard to keep us safe, because safety should always come first. Although I know, like many community members, I'm itching to get out there and dine, and do all of these things, but safety first. So
it's coming, and we so appreciate the patience of our community and the community really coming together to stay healthy and balance the economic health and the medical health of the community. And we appreciate you and your office for putting out the word and helping keep everyone informed as well.
Of course. Well, thank you. And I just want to reiterate what you said, which is to everyone listening to this, thank you. You staying home, you abiding by these orders has really gotten us to the place where we are, which is saving tens of thousands of lives, keeping our hospitals at capacity so we've been able to treat everyone, have the ventilators we needed. And so thank you for continuing to comply with all the orders and really trusting our public health officers to know what will keep our community safe. And that may change in the future. And so we just ask you continue to be our partners in keeping everyone safe. And so it's just a reminder that although we're continuing to open and we're so grateful for all of that, that the risk of contracting and transmitting COVID-19 is not gone. And we have to remain vigilant, which means wearing our face coverings, washing our hands, keeping that social distance that we all talked about, and staying home when possible. So I want to thank Dr. Scieli for joining us today and for his amazing work in keeping our community safe, along with all of his colleagues at the county. And as always, please do not hesitate to reach out to my office if you have questions about this topic or anything else with state agencies. We are here to support you. You can reach us at 925-328-1515. Thank you, and stay safe.